this room to help Gladys with something. And Gladys was 100 years of age. She still had a brain and could talk, but she couldn't really take care of herself at all. And Gladys, at that point, since I was just in the room with her, began to talk very fast about trying to get me to actually have sex with her at age 100. Hurry, nobody will notice. Come this, and you know, she's sitting there giving me instructions, and I was appalled, wide-eyed, and I ran out of that room. And I told the nurses what she had just said, and I was shocked at their reaction. I thought they would be wide-eyed and shocked and upset, but instead, they just laughed. And they said, "Oh, that's Gladys, that's Gladys." And they made me go back in there and do what I was supposed to complete in doing. And I realized no matter how old you are, sex is still on the brain. And I've noticed it even in regards to the elderly, et cetera. It's something that, you know, we're designed with. It's actually part of our being, et cetera. And so we don't have a lot of time. I'm not going to take probably as much time on this, but we're going to be talking about brain chemicals. We'll also be talking about cohabitation. I don't know if that happens in Zimbabwe, but it happens in the Western world before marriage a lot. We'll be talking about the stages of marriage. We'll be talking about sex and brain biochemistry. We'll be talking about supernormal stimuli. By the way, we've already talked about a supernormal stimulus already. What did we talk about that's a supernormal stimulus? The smartphone, yeah. And then we'll be talking about culture versus science. And then we'll be talking about the solution to the issues. First of all, the brain chemicals that are involved. There's more involved in this, but the main ones are phenylethylamine, dopamine, oxytocin, opioids, and prolactin. Of course, we could talk about others too. Estrogen, progesterone, testosterone, they have their role to play as well. But phenylethylamine is the love chemical. And when you fall in love and you notice you have chemistry with this other person, that love chemical makes you less aware of the faults of the other person. In fact, you kind of have this euphoric high, that feel good. Everything is wonderful. In fact, this person can do no wrong. We've oftentimes seen people who fall in love with somebody and ask, "Are you blind?" Well, yes, they really are blind. And almost no one can tell them at that stage of the game because phenylethylamine is pouring out in large quantities. I've noticed most people, when they hire somebody, they'll check the background of an employee and they'll look for references and things like this. But in romance, some people will try to give them references, but they don't pay attention. And that's because phenylethylamine is pouring out in large quantities. So notice how long it lasts. From a few months to how long? 4 years. Now we're going to get into how this can actually last a lifetime. It does in 1% of marriages. Only 1%. But the typical average length is 18 months. And that's when kind of the high wears off, and that's when the individual starts recognizing that maybe there are some issues with this person that I love so much, and that euphoric high starts to wear off. Dopamine. Dopamine is known as the molecule of addiction. It causes us to want, to desire, to seek out, in search. The greater the dopamine released, the greater desire to do it again. And dopamine can be released even with food. There's actually 5 natural things that tend to release dopamine. Celery, not a lot of dopamine released when you're eating celery. Chocolate cake and ice cream tends to be a big blast of dopamine. But the largest amount of natural dopamine released is actually sex and orgasmic activity. So if we were to put it in the greatest dopamine released, we would have it this way. We'll get into that and what that means here in a little bit. Oxytocin is the bonding hormone. Oxytocin is released during labor, breastfeeding. It's not released with sexual activity unless it is a committed spouse, committed loving spouse. They have, for instance, looked for oxytocin in casual sex. They get dopamine, they don't get oxytocin. And that dopamine without oxytocin is going to cause some significant problems down the road. And so this is one of the reasons why this bonding hormone is one of the reasons that they have elucidated that if you have never had sex going into marriage relationship and your spouse has never had sex going into relationships, they're calling that divorce-proof couples. In other words, they're already committed, they've decided to get married, and they committed to each other first, and they're getting oxytocin the first time. And they're getting dopamine and some other things as well. And the studies show, beware, if you're getting married to someone who's already had sex with more than 5 people, they're very unlikely to stay with you. They're very likely to tire of you. And they're going to be looking around pretty quick. And they're very much in that PEA. When that PEA wears down after 4 years, watch out. But there's other things leading to that as well. Opioids. Opioids can also be released. You can get euphoric responses attributed to the higher order of emotional and neurological symptom. And opioids will also be released with sexual activity. But not all sexual activity will have the nice opioids. And then finally, prolactin. Prolactin is secreted from the pituitary gland. And this will be released with only certain types of sexual activity after orgasm. And I should say a certain type in particular. They've looked, for instance, masturbation, you don't get prolactin. You don't get oxytocin. Prolactin is very protective for protecting your dopamine and dopamine receptors from being picked off by the dopamine surge that occurs with orgasmic activity. So the post-orgasmic prolactin release following intercourse is far greater than following other types of sex. And Stuart Brody is the one that discovered this at University of California, San Diego. And also Dr. Kruger as well. So you meet someone and fall in love, which chemical will be released? See if you're listening. PEA, phenylethylamine. So then, what's next? What happens in about 3/4 of relationships in the Western world is not marriage when you fall in love, but premarital cohabitation. Greater than 70% of couples live together. before they get married. And they've compared those with couples who get married first before they live together. And they've been looking at this for quite a while. The premarital cohabitation effect has been very consistent along the studies. When you do get married, your marital satisfaction is far less than the other way around. You have less dedication to your partner. You have less commitment. You have lower confidence. There's more negative communication between the partners, and you're much more likely to get divorced than if you have premaritally cohabitated. And this is not intuitive for people. They think, let's try it out first. The reason why they're wanting to try it out is they're not quite ready for that commitment yet. And the idea is, if I like you enough doing this, then maybe I will marry you. And it's also shown which gender is most commonly looking for marriage in those relationships. Which gender do you think it is that would like to get married? It's the female that wants to get married. And of course, as some people say, females give sex to try to find love. And males will give love to try to find sex. And so in their giving of love, sometimes it's that fake love. It's not that real self-sacrificing, committed love, because they're after that aspect of things. But the woman is thinking, hey, okay, I'm willing to try it. I really love this person. I think it can work out. Maybe if I satisfy him enough. And so there's always this lack of security, lack of confidence. And unfortunately, that affects the intimacy as well of this couple. So 85 to 90% of women in the USA born after 1962 had sex before marriage in America. By the way, what happened in the 60s that changed things in America? Does anyone know what it was? There was a big cultural shift. That cultural shift was started by the hippie generation. The hippie generation brought us drugs, casual sex, and rock and roll. And so you had the syncopated rock and roll rhythms, and you had this, and of course that was kind of rebellion was part of the whole aspect of things. By the way, I was born right in 1962, so I was right on the edge of where that took place. But the hippie generation certainly was occurring before I grew up, and I remember that shift even as a young boy. And I remember hearing the arguments from that generation in regards to the casual sex. They said, you know, before you buy a pair of shoes, you try it on first. That would be the argument. And, you know, maybe the shoe isn't going to fit. Well, I can tell you, if there's healthy couples, I don't care how big one person is and how small the other person is, but it always fits. You don't have to try it on first. But he wasn't saying anything about that. So premarital sex increases risk of divorce, especially when there's a different partner than the one that you're married with. So the reasons have actually been shown to not be explained by social factors, and there's no evidence of gender differences here. So what happens during sex? There's this huge dopamine release. And then what's next? Well, you either split up after this, or you get married. And the concept of inertia. We're already living together, we might as well get married. There's social pressure, etc., that sometimes bring them together. By the way, when you're cohabiting, because you're not completely sure that this person is for you, what if there's a person you meet that does fit you so much better? What's likely going to happen? What's likely going to happen is the one who fits you a lot better is going to say, "No way, Jose, you're already with him." And so you decrease your chances of finding that Mr. or Mrs. Right that fit you well. So cohabiting is actually not a wise thing. If you're not completely committed, you may actually pass by the very one, or that person will pass by you because they're not going to try to enter into something that you're already having casual sex with. So in marriage, you're bonded but may not be a good fit. So let's go through the stages of marriage. The stage of marriage, often at that wedding altar, when the wedding is occurring, the audience is really smiling as well as those vows are taking place, and these young people are uniting themselves by words like "until death do us part." This stage is called the stage of euphoria. It is sometimes called the honeymoon stage. And PEA is still flowing normally when marriage occurs, or it may not be. You might already be in stage 2 by this time if you've been cohabiting. But after the stage of euphoria is the next stage. What's the next stage after 4 to 18 months? It's called the stage of non-euphoria. In other words, you still love the individual, but it's not quite as euphoric and romantic and hot and so close. And couples will think that this is just normal. You know, we went through the honeymoon stage, now it's not quite as good, and now you're starting to notice some things that kind of irritate you about your mate. Never noticed this before, but this is a little bit irritating. But you're still committed. You know you've taken your vows, you're still committed. But if the things that led you from euphoria to non-euphoria are not fixed, which normally they're not, it might take 5 years, it might take, well, it takes 4 years before you get to non-euphoria often. It could take 10 years, could take 15 years, but then you're very likely to enter stage 3. What's stage 3 of marriage? It's called the despicable stage. This is where you look across the room and you look at your mate